However, we will start now. My name is Kate Chanturia. I'm professor in psychology of eating disorders and consultant psychologist in South London and Maudsley NHS Trust. I'm introducing myself because picture Ulrike showed you was 27 years ago taken, so you might not recognize me. So over to you.
Yeah. Hello, I'm Başak İnce Çağlar. I'm postdoc with Ulrike, working on Edify Consortium. Nice to meet you all and see you all.
Great. So because of interest of time, I will not read titles of the talks. Probably we will save time with it. But it is my absolute pleasure to introduce our first speaker, Dr. Karina Allen. Karina is consultant clinical psychologist in our eating disorder department, and Karina is doing lots of elegant research, as Ulrike said. You saw her face, and I'm delighted to give floor to you, Karina. Over to you.
Thank you so much, Kate and Basak and Ulrika, for having me speak in this section. And I'm really delighted to be here talking to this theme of freeing up young people and services from the burden of eating disorders, talking on both FREED and FREED-M. And my plan for this talk is to introduce FREED and FREED-M, set the scene for why they were developed, and then highlight some key findings from these two programs of work. So FREED is first episode rapid early intervention for eating disorders, which is a research-led evidence-based service model and care package for 16 to 25-year-olds who've had an eating disorder for less than 3 years. FREED-M is FREED Mobile, a smartphone-friendly online decision-making tool evaluated this year in a randomised controlled feasibility trial. Before I go any further, I want to acknowledge that whilst I'm presenting this morning, it's very much on behalf of teams of individuals, so the core FREED team on the left and the FREED-M team on the right. And particular acknowledgements to Helen Sharp and Dina Monson within FREED-M, who've really worked tirelessly over recent weeks to facilitate some initial data from the feasibility trial for me to present today. So to set the scene for where FREED and then FREED-M came from, this slide is my attempt to simplify quite a complex process from which someone might first develop eating disorder symptoms and eventually progress to accessing treatment. So you can see at the top of the slide, we've got this first onset of eating disorder symptoms, what we might call a high risk or prodrome phase. And not everyone who develops eating disorder symptoms will progress to a clinically significant eating disorder, but we know that many people do. Once people have hit that diagnostic threshold, there's often a very variable, quite convoluted route by which they may reach awareness of having an eating problem, making a decision to seek help, having first contact with a health professional, often a general practitioner, and then being referred for specialist eating disorder treatment, with waiting times often between both assessment and then treatment commencing. And each of these points can be subject to delays, to barriers, and ultimately to people perhaps not progressing through these steps and never accessing care at all. And related to this, Millie Austin led a review to find that the mean duration of untreated eating disorder, or DUED, ranges from 30 months on average in anorexia nervosa up to 67 months for binge eating disorder. So this is between 2.5 and 5.5 years from when someone meets clinical significance for a diagnosable eating disorder to starting any evidence-based treatment. So FREED was developed to try and impact on this latter part of the cycle, trying to encourage primary care practitioners to refer promptly if they identify eating disorder concerns, really proactive engagement with a young person once they've been referred to a service. Waiting time targets of 2 weeks from referral to assessment and 4 weeks from referral to treatment, and even greater emphasis on early change than we would usually have in eating disorder treatments, and developmentally tailored care. So FREED is using our same existing evidence-based eating disorder treatments, but it's tailoring treatment to the age and stage of young people with a recent onset disorder. And you can see more about the FREED program in the stall at lunch if you're interested. FREED has been running now for 9.5 years, and some of the key findings that have emerged over that near decade of work are that Freed does seem to consistently reduce duration of untreated eating disorder by an average of 4 to 6 months compared to treatment as usual. It also increases treatment uptake from around 70% in treatment as usual to almost 100% with Freed. And it increases weight recovery in anorexia nervosa from 18 to 35% within a year of assessment in treatment as usual to 56 to 59% with Freed treatment. And related to the reduction in needing day or inpatient care, Freed saves on average around £4,000 per patient treated. This figure on the right shows the scaling of Freed over the last 9.5 years, and you can see particular upkick in the last 3 years, where following initial support from the Health Foundation, Freed was selected for national scaling by the Academic Health Science Networks and is now running in 54 trusts around the country. And over the last 5 years, we've seen over 5,000 young people have a Freed assessment, over 3,000 have started treatment, and over £11 million has been saved to the NHS. And the intention has always been that savings from Freed can go back into the system to improve care for all eating disorder patients, regardless of age and stage. So this talks to the second part of this diagram, but of course we've still got the challenge of having people become aware that they have a problem that might benefit from treatment and making that decision to seek help. So this is where Freedom comes in. Freedom, or Freed on Mobile, is a smartphone-friendly online decision-making tool intended to try and facilitate that increased awareness and help seeking around eating problems. So it consists of personalised feedback on eating disorder symptoms and related aspects, a series of 4 short animated films providing key psychoeducation on help seeking, gut health, the impact of eating disorders on the brain and social media, downloadable resources to complement each animation, and reflective prompts and ratings around each animation. And I've included some stills from the films on this slide, but again, you can watch them over lunch if you're interested. So we evaluated Freedom this year in a randomised controlled feasibility trial, with the intervention running over 4 weeks. So each week participants accessed a new animation and associated resources, and then a follow-up 12 weeks after randomisation. And as a feasibility trial, our primary feasibility outcome was attrition at the 12-week point, with secondary feasibility outcomes being recruitment statistics, assessment completion rates, intervention use and acceptability. So this is our first half of the consort diagram, which I'll go through fairly quickly in the interests of time. The key things I want to highlight are at the top. You can see there were 462 unique expressions of interest to take part in the trial over the 6-month recruitment phase, December to May of this year. And then progressing down, there were 204 participants who were enrolled into the trial, and recruitment was really consistent over the 6 months. We really had no difficulty finding interested participants for Freedom. After randomisation, we had half of the sample access Freedom immediately, and the other half accessed the control condition, which involved completing the same measures at each time point, but being encouraged to access the BEAT Eating Disorder Charity website for resources over each of the 4 weeks of the intervention. And then that group had access to Freedom at the end of the 12 weeks. And here what I want to highlight is that if you look at the very bottom of this diagram, we had 44% of the Freedom arm, shown in purple, completing their follow-up assessment at 12 weeks, compared to 34% of the control condition. So retention in Freedom showing initial sort of positive signs. Thinking about the acceptability of Freedom, we asked participants to rate each of the animated films from 1 to 5 stars, and that's what this figure at the top left shows. So for each of the 4 different films that they viewed, and you can see a clear skew towards the higher end of the rating scale, with over 95% of participants rating each animation of 3 out of 5 stars or more. We also asked participants to rate the overall acceptability and usefulness of Freedom as an intervention. So this was at the end of the 4 weeks, and 79% liked it moderately or a lot. So these are the blue bars shown, and 67% found Freedom moderately, very or extremely useful. So these are the purple bars shown. So overall, the initial feasibility trial results seem to support progression to a full RCT. We were able to recruit, fairly well able to retain and have good feedback from participants on acceptability and usefulness. A full RCT will of course allow us to test if freedom increases help-seeking behaviour or motivation to change. We are still to estimate the effect sizes to inform a full trial planning and also undertake the qualitative analysis of feedback on the animations. It's also worth noting, of course, that Freed services need to be able to meet the demand if we're able to increase help-seeking and referrals for eating disorder care. And that links up to sort of the final point I want to make, turning back to this slide, which is that Freed and Freedom are addressing particular elements of help-seeking and access to treatment for a particular patient group. But of course, there is still more to be done in preventing, identifying early, and also making sure that we've got treatments that can actually meet the needs of everyone who's coming forward. But of course, that's where other programs of work being presented today come in. So I will finish with thanking again all of the Freed and Freedom teams, also our funders for both parts of the work, and time for any questions.
Much, Karina. Excellent timing, and we have Karina researchers here and co-producers. So, any questions from you first? Yeah, go ahead.
The microphone.
Ah, I see. And
what a great talk! Thank you. You mentioned the qualitative analysis of the animation, so I was wondering if there were perhaps any early findings or if you have any thoughts on how the ratings of usefulness and acceptability could be improved even further.
Thank you. The only early findings I can really speak to are that it seems that we're getting positive feedback on the animations. So the qualitative data are coming both from some online text feedback that we collected after each animation during the intervention, but also more in-depth qualitative interviews with a subset of the Freedom participants. Both of these sources of data are giving us positive feedback overall. I think the gut health animation is kind of particularly well received, which is interesting to hear as something that maybe we haven't attended to very much in eating disorder treatment previously. But otherwise, I'm afraid it's still to come and you'll have to stay tuned.
Thank you.
thank you, Karina. We have time for one quick question, if there is any from audience. Yes, please. Over there.
Thank you, very nice talk. I was wondering if you collected data on how much the participant engaged with your tool and if it correlated with exactly how they rated it. Thank you.
It's a very good question. We are trying to get that data out of the website as we speak. So the trial, as I say, finished recruiting in May, and then there was the 12 weeks, obviously, from the last recruitment and enrolment. So we're just at the end of all the data being collected and still getting hold of some of it. Thanks.
Thank you so much, Karina. This was excellent.